Hi everyone, welcome to People for Cities. My name is Ritika Akhil Kumar. I'm an architect and urbanist based in Chennai, and I'm also the founder of CoLab. So People for Cities is CoLab's initiative through which we hope to engage with more sections of the general public about the major issues that concern our cities. So this time around, we thought we would discuss COVID-19 being the topic of the hour. So just to give you a bit of an idea of how this session will be structured, we will be starting with a presentation which should go on for about half an hour. In between, there will be a couple of short activities to engage in. And at the end, we do have time for a discussion. And if you have any questions during the presentation, you can enter it into the chat and we'll get to it at the end. Is that all right with everyone? I hope everyone can hear me. All right, so yeah, without further ado, let's just start. So, like I said, the topic we will be discussing today is COVID-19 and the city. So, to begin with, we are going to look at what traditional planning practice looks like in most of the world's cities today, what the focus is on, and then kind of look at also coronavirus as a disease and what its nature is, and what sort of concerns it arises. What sort of concerns arise out of the situation. So generally, when we talk about planning, city planning in specific, we talk about services, infrastructure, generally services like water supply, waste management, healthcare, etc. are centralized. These are generally controlled by regional governments or national governments, and allocation of resources is largely top-down, which means that the resources are allocated by the government and the people don't really have a say in how this allocation happens. So in this sort of a system, there are many sections of society which are left out. We also talk about land use when it comes to planning. As you can see on the right of your screen is an example of a land use map. And you see that certain areas are exclusively residential, certain areas are exclusively demarcated for business, so on and so forth. So in this kind of situation, we do have this reliance on transport. So we do bank on the fact that we can move from one end of the city to another. Another sort of concern with planning practice is the need for densification, especially now with climate change and the kind of rapid urbanization that we see in our cities. There is a focus on increased densification to accommodate more and more people within lesser areas. So in this, in this scenario, we have densified living areas, but at the same time, services, like I said, are located at distances, which means that we need to travel, coupled with land use patterns as well, which means that from our place of residence, we need to travel to get to our place of work or to access any public institutions, government agencies, etc. Like I said, since there is this increased reliance on private transport especially, there is also this phenomenon of urban sprawl which is taking place, where more and more people are moving to the suburbs and peri-urban areas where you can find land, housing for much cheaper rates, and it gives you sort of the promise of a better life than what you would get in the city, because prices are much higher in the city. The amount of space you get for a particular price is much lesser. So you see this kind of expansion of the city's footprint, basically. Then we also see that generally when we talk about planning, when it comes to different countries, there is a focus on the major metropolises as the important centers of um, urban growth. So largely funding, infrastructure, delivery of services is allocated to these major cities, major metropolises, and then you come to cities, and then towns, and then villages. So there is a gap in the ways services and infrastructure are delivered to different parts of a particular country. And all of this is enabled by this sort of market-driven approach to planning, which basically looks at profits over quality of life, so and well-being of citizens. So even when you look at, say, these slum rehabilitation projects and such, the idea is to fit in as much as possible in as cheap a cost as possible, in a much lesser area, which means that that the residents don't necessarily get the best living scenario possible, which means that they are susceptible to many more risks, not only health related but climate related, and so on and so forth. So, coming to this disease, we know that the coronavirus is highly infectious. We know that there is a high rate of transmission, which, the disease is transmitted through droplets of saliva. So, with all this, what we're trying to say is that social distancing becomes a very important factor when you look at a coronavirus response. And another important factor is to flatten the curve. So the number of cases need to be managed so that there is not an increase in, there is not too much of a burden on healthcare systems. Now, this is generally the global approach that we see, but there's also varying degrees of success or failure that you see around the world. So, how have governments largely around the world been tackling with the outbreak? So, we see social distancing, travel restrictions, alternative transit systems, and transparency of data as a common, I wouldn't say a common theme, but a more common occurrence around the world. So, with regards to social distancing, we all know we have to maintain a distance of at least 6 feet to make sure that the saliva droplets that we might release when we sneeze or cough or talk don't necessarily affect another person. Many cities around the world, many countries like India, where I'm from, have been shut down. Shelter-in-place orders have been issued. There have been curfews, so on and so forth. So people movement has been highly restricted. So, like I said, there are travel restrictions within. Whether it's at the global level where you see, flights being stranded around the world. There are many countries you cannot travel to, many countries from which people cannot travel to your country from. So on and so forth. And again, at the local level, we also see that travel between cities or states is not possible right now we can do it, but then you require an e-pass here in India, which means that you need to apply for government permission to move around. Even certain areas which have been identified as hotspots have been sealed off so that people within those areas cannot move around in the rest of the city. So, an interesting result of this kind of lockdown, as strenuous as it has been, and its success can also be debated, but this kind of reduction in travel has uh, caused a sharp decline around the world in air pollution and in carbon emissions. Suddenly in India, in Jalandhar, which is a city in North India, you can suddenly see the Himalayas, and people haven't seen the mountains for decades, even though it was always there, but you couldn't see it because of all the smog and so on. So the effect on the climate has been good for the current time being. But as cities reopen, one also wonders if there's going to be a sudden surge in travel, which could kind of reverse this entire effect. So, like I said, since there are travel restrictions, since there are restrictions on using motor vehicles and traveling long distances and so on, there has been an a sharp decline in the usage of public transit. So, in cities in India, at least, we haven't had public transit completely opened up yet. Because it is also generally all these buses and trains are packed in Mumbai, in Chennai, wherever you go. So it's not exactly an ideal scenario for social distancing. So there is an increasing dependence on private modes of transport, but even this cannot be feasible for everyone simply because everyone doesn't have the means to own a car or a scooter or a motorbike or so on and so forth. So it's not necessarily an option for all. But you also see cities around the world like Bogota, like Berlin, Paris, which have introduced these temporary sort of pop-up bike and cycle lanes, which um, allow cyclists more space so that they can socially distance while they ride their cycles during their daily commute, and also afford pedestrians increased safety during their walk. And again, everyone has the option to travel safely, both from motor vehicles as well as from a health standpoint. And then we see the use of technology in many countries like India and South Korea. We see apps being used for contact tracing, for syndromic mapping and self-assessment. So basically, through these various apps, like whether it's Go100 or it's Arogya Setu in India, you kind of can use the map to see if there are any infected persons near you, and at the same time you can self-diagnose to see whether you have any of the symptoms and need to get checked. So this kind of initiative has been appreciated, but also has been criticized because there are a lot of data vulnerabilities here. There is the potential for surveillance from government authorities. So there are privacy concerns as well. But at the same time, we have seen a fair bit of success with such models. So some key observations that have been made by various authors around the world through this pandemic and the kind of effects it has had on local populations. First is that we see highly densified cities around the world, whether it's Mumbai, whether it's New York, London, all over. But there was initially a kind of opinion imposed saying that higher densities, higher population densities mean that there is a higher risk of disease transmission. So This over time has been proven to be not completely false, but to a large degree. Of course, yes, higher population densities mean that you're in contact with more people, but there's a difference in the kind of, depending on the kind of neighborhood you live in, whether there are socioeconomic factors that influence this kind of transmission, racial factors. So, for example, in the case of New York, Manhattan is supposed to be really dense as a borough, but generally in Manhattan, it's more of sorry, not working class, but these are people with stable jobs and healthy incomes who live in Manhattan, while areas like, so those areas, despite being highly dense, have seen far fewer cases than other boroughs like the Bronx, Queens, and Staten Island, which are far less dense. But then these are areas which house low-income communities, marginalized communities, which means that these are people who live in smaller areas. So we're looking at not population density at the level of a city or a borough, but at the level of a room or a home. So when there are, it's not a question of whether 10 people, 10,000 people are packed into a particular area, but whether 10,000 people are packed into, say, 100 apartments. That makes a lot of difference, because the homes in these areas are largely multi-family homes, which house a lot more people. So the potential for social distancing here is far lesser. Like I was saying, there are urban inequalities that need to be addressed. COVID-19 does disproportionately affect the marginalized. Initially, there was this narrative that was being sort of peddled, saying that this disease is the great equalizer. The disease does not, distinguish between someone who earns a lot and someone who doesn't. While the disease might not make that distinction, the kind of living environment that people are afforded kind of makes that distinction very stark, because these low-income groups, the urban poor, basically often live in informal settlements, cramped conditions, which don't allow for social distancing. Access to basic services like water, like sanitation, is very scarce, or even not there in many areas. So in this scenario, you can't even wash your hands. How you're going to maintain hygiene levels, the extremely high hygiene levels that are being demanded of us? There's no soap, there's no water. How do you do it? Also, with the urban poor, there is a necessity to work, because the shutdown means that they don't have any work, which means there's a loss of income, which means that they probably have to go hungry. So generally, such areas see a lot more people go out in search of work because they cannot afford to stay at home. We need to understand that work from home is also a luxury which is not afforded to everyone. And also many people from low-income communities are also the people, the frontline workers that you see, whether it's waste collection, whether it's health workers, uh, food delivery people. It's it's mostly these people who are going out and delivering services, but then there's not enough infrastructure or basic essential services being delivered to them, which is sort of a vicious cycle if you look at it. So in India, this is something that happened earlier this year. So this loss of livelihood means that people no longer have a place to live in, don't have enough food to live with. So many of these migrant workers kind of wanted to go back to their villages because they might have some kind of housing there or property there or cattle or whatever that might enable them to at least not starve every day. So there were many people from Delhi especially, but all metropolises around the country who kind of wanted to go back home. But at this point of time, most government services had also shut down between cities, between states, essentially. So in this case, you saw that many people, thousands and thousands of people, started walking vast distances to get home. Now, this caused a major concern because there were many people who were dying of hunger and exhaustion during these long walks, marches, essentially across thousands of kilometers. At the same time, this also created considerable pressure for government agencies because suddenly you had to deal with so many more people on the streets while a shutdown was supposed to be in place. So in this case, we saw like vast number of people being detained and sort of kept on the streets, even in many areas, till people kind of figured out what needed to be done with these people. So in this case, emergency services like temporary shelters were erected, or people were housed at local schools and things like that, till the government could decide how effectively these people could be addressed. Now, the criticism is that this kind of figuring out of how you need to deal with these people should have been done before the shutdown was imposed. But that's generally the theme that we saw across the country, that shutdown was imposed, but then it wasn't necessarily very well planned. So when we're looking at sort of long-term solutions to this, when it comes to planning, how do we address these sort of issues that we've discussed so far? And at the same time, also discuss other issues that should be influencing planning these days. So we're going to be starting with this concept called urban resilience, which is basically the capacity of individuals, communities, institutions, businesses, and systems within a city to survive, adapt, and grow no matter what kinds of chronic stresses and acute shocks they experience. So basically, resilient cities are supposed to be those which can absorb any kind of new threat and react to them. So these kinds of cities can only be built with a lot of analysis of the existing urban fabric, and then accordingly we need to plan a future infrastructure and services, and even urban form needs to be planned accordingly through participatory planning. We do need expert knowledge, but then we also do need the involvement and cooperation of the general public in doing these things. And then finally, through extensive and sort of in-depth planning and analysis, we need to also implement this in a timely manner, implement any plans that are made in a timely manner. So urban planning with regards to cities, like I said, happens mostly in a market-driven manner. So instead, what would happen if we focused on the well-being of citizens and kind of looked at a comprehensive approach to urban planning? So first thing that needs to be done is access to essential services. Like I said, in our cities, there is the way our cities are planned and built kind of prioritizes the delivery of services and infrastructure to certain sections of the society over the rest. So we see that more and more government-run agencies and government-run services are now being moved over to the private sector, which means that when it's owned by a private corporation or individual, it's very natural that they are going to prioritize their interests over, the collective well-being of all citizens. So in this scenario, there needs to be kind of decentralization of services. Like I said, in our cities, all services are concentrated at certain centers around, in the city, which means that it's not necessarily accessible to everyone. So this could probably be addressed through the creation of self-sufficient neighborhoods, where you kind of have multi-use neighborhoods where people kind of live, work, have socializing, and so on, and at the same time they have the same access to services, to food, to water, to housing, everything within the same area, so that in case of this kind of shutdown or any other form of disaster which would require sort of certain areas to be cordoned off, then these people do not have to kind of rely on other parts of the city to be supplying them with these services. So in this case, you're kind of minimizing the contact between a particular area and other areas when need be. But at the same time, you can have in normal times, you can have a network of these villages, which are I call them villages, but urban neighborhoods, which are self-sufficient. But at the same time, it is possible to travel from one to the other when need be. Through public transport links, well-established public transport links. So this makes sense not only from a pandemic response point of view, but also from a climate change point of view with regards to reducing the amount of energy being used. And at the same time, it allows all citizens better access to local governance, which means that you have better accountability. So, food, income, and housing insecurity. Now, like I said, with regards to the pandemic, there were many migrants in India who had to kind of leave their existing homes in these major metropolises and kind of move back to their villages. Now, why was that something that happened? It was because that there was no sort of emergency preparedness from the government point of view, where they could provide food and income to these marginalized communities. So these people had to essentially still go out and find jobs and find income to survive, essentially. So, like I said, social distancing and work from home are actual luxuries that are not afforded to all sections of society. So there needs to be an approach to planning which does not leave anyone behind. I think with regards to housing, we've discussed quite a bit early on, where there needs to be good quality housing, which is affordable housing, which is supplied to people, which does not focus on profits and optimization of space, but rather on well-being of residents. Then we have the integration of open spaces. So open spaces like whether it's built public spaces like squares, or whether you're talking about parks and lakes and so on and so forth, they need to be integrated into the urban fabric of cities. Now, we are seeing across the world, there is a surge in the number of people who are heading out to parks, because there needs to be some kind of respite from all the time we spend at home right now. But also in general, open spaces are central to both the mental and physical well-being of citizens. So these kind of open spaces need to be integrated into the planning process. By doing this, we not only can respond to pandemics better, because there are studies that also say that the risk of catching the virus outdoors is lower than that indoors. There are also other benefits like better health, better water management in case of flooding that we see in many cities, climate adaptation and mitigation strategies. So, like I said, there needs to be comprehensive steps that are taken when it comes to future planning. Then we also see that this pandemic has forced us to lead increasingly digitized lives, which means that we are carrying out many of our activities online as we are right now. So in this scenario, there is a necessity to deliver good quality internet connections, computers, laptops, whatever, so that people can all people can be involved in this kind of work setup that we have right now. There are also many children who miss out on education because they do not have such infrastructure ready to go at home. So, these need to come from the government, because all, like I said, all citizens should be afforded equal opportunities. So, especially when technology is enabling us to kind of do the social distancing and engage in minimal contact well, so that even like trade and the economy doesn't get hit on a day-to-day basis. There are activities that can be carried out online, uh, so those should be available to everyone. But there are also concerns over privacy, over fake news, over digital rights that need to be um, addressed before you can be completely reliant on these things. And there always needs to be a kind of oversight of such facilities, like with any other kind of service. Um, Again, with digital infrastructure, it's also possible to provide data and government services for more and more people without having to have them crowd at some corporation office or municipal office or something like that. So we see that with apps like this Arogya Setu app that I talked about, or Co100 app that I was talking about in South Korea. So these are we are becoming an increasingly digital world. So accordingly, the infrastructure and the services for that need to be provided as well. We also require more reliable data locally. Many of these informal settlements, especially, do not have enough planning data according about them. Like since they are built of largely of temporary materials and so on, these are not areas which are extensively mapped. You might not even know how many people actually live in those areas in many cases. So without having this information, how do you deliver services and also emergency services? Regular times, yes, but in such pandemics, how do you ensure that enough people in those areas are being tested, are being taken care of if anyone has tested positive? So these areas need to be extensively mapped, and the data needs to be made available to more and more planning agencies. We also need to rethink these kind of networks that we see both at from the global local level to the global level. So many of the cities that we live in have obviously we don't live in isolated cities. There are surrounding areas that supply services and say even whether it's services, resources, everything comes in largely from the peri-urban areas, right? So in this scenario, there needs to be a better coordination, especially in this kind of pandemic, between urban, peri-urban, and rural areas, because there is a high rate of movement between these areas, whether in terms of economy, energy provision, transport networks, and food production. So at the same time, we also see that cities are a part of vast global networks. So interestingly, the first case of coronavirus in Germany arrived from Wuhan because someone who was working at a car parts factory in Wuhan actually traveled to Germany without knowing that he was positive and kind of traveled back and then tested positive in Wuhan when they were ramping up testing in China. And he had transmitted the disease to many members of the same car parts factory in a city in Bavaria. So there is a lot of mobility across the world that has been enabled with the advent of air travel. And in this scenario, this shutdown needs to have come a lot earlier. That we saw the shutdown that we saw starting in March needed to have started probably in January. Now, this could have been possible if there was increased global cooperation and knowledge sharing, but there was sort of knowledge withheld at different parts of the world. And it's not only a single country being affected in such pandemics, so we need to kind of coordinate those efforts around the world. Even with the vaccines that are being produced now, we see different countries sort of promising that this our country will be supplied first, and then only we will be looking at exporting it to other countries. But we don't see a sort of global effort or enough of a global effort. So when it comes to architecture and general urban behavior, there needs to be a kind of reprogramming of how we behave in urban spaces. We see this happening in many cities using elements like painted circles or areas demarcated using tapes and so on. So there needs to be this kind of social distancing that is built into the urban fabric. There needs to be, maybe we might not need to distance for 6 feet in the future, but you cannot have places packed with people packed like sardines. You cannot imagine going to a club or a restaurant which is packed completely. And in this sort of post-pandemic world, there is both the fear of disease and the actual disease that needs to be tackled. So we need to kind of see this need for hygiene and sanitation built into these spaces, and which dissuade people from overcrowding. And we also need to rethink urban mobility. So right now, like I said, there is a sharp decline in public transport around the world, both because of shutdowns and because of people being scared to use them as they would have before. I can tell you from experience in India, buses have people packed in, hanging from the door. So it's an extremely overcrowded environment. That kind of scenario will definitely lead to disease transmission. So there is no question about it. So in this scenario, there is a necessity to kind of rethink how our public transport systems and also, car sharing providers, for example, carpooling systems that we have, all those need to be rethought. And something as simple as having sanitizer in every taxi you take or in every bus you take at the entrance, even that is some kind of measure that you can take to regain public trust. Also having a cap on the number of people who can enter a train or a bus at a time. Things like that need to be thought of and dealt with. Maybe there needs to be an increased frequency in services so that lesser people can take the same bus. So, for example, if there's a bus that comes every 10 minutes and it accommodates 100 people, maybe we could make it a bus every 3 minutes and each bus could accommodate only 30. So, these things need to be thought of. And at the same time, I think one thing that can be taken forward in post-pandemic planning, regardless of whether or not there is a disease to be dealt with, is this increasing infrastructure for cycling and for walking. Um, this is not only a good idea in terms of social distancing, in terms of providing space for all sections of the public on the street, regardless of what kind of vehicle they have. It also makes sense from a climate change perspective because you're cutting down on pollution levels, on emission levels. So there is a need for a comprehensive approach to this, to the planning of urban transport systems, so that you have reliable, accessible, affordable transport options which minimize the impact on the environment. So that's basically all the long-term actions that I could think of that I think are central to this response to this pandemic that we're facing, but also to other important issues that we're facing around the world. So I'd like to wind up my presentation here, and I'm also going to share these links with you. Probably you can have a look if you're interested in getting more information about this sort of post-pandemic planning response that needs to be there. So thank you very much for joining in today. We can have a quick discussion session, maybe if you all could unmute yourselves right now. We could have a discussion here, and also you can email me at kritika@colab.in. All right, if anyone has any questions, you can ask me right now.
Shall we get it? Can you hear me?
Yeah, Helena.
Oh, hi. Cool. Thank you for the interesting presentation. It was really very insightful. I did read a bit and write a bit about the kind of spike in cycling in some cities, but actually going through international examples, we mostly see Western cities that see really like rise in cycling. So I wanted to ask a bit more, how do you see the situation in India? Do you also see here a rise in cycling, or at least an increased interest, or is it not at all on the screen? Thanks.
So with regards to cycling, that's what you're asking about, right? With regards to cycling in India, unfortunately, cycling and pedestrian activity is not at all prioritized in planning practice here. So what we see is mostly roads which are not at all equitable. So there might be, a pavement which is 2 feet wide on one street, and then on the next street it might disappear completely, or it might become 2 meter wide. So there is definitely a lack of infrastructure when it comes to cycling and walking. But at the same time, you will see high levels of a high percentage of cyclists and pedestrians in India, simply because it's the most affordable option. For example, in Mumbai, there are people called dabbawalas who essentially deliver food to lunch to most offices where people are working, and this is like an everyday food delivery system. So these dabbawalas use a lot of these use a lot of cycles to get to their different locations across the cities. So you will see a very, very high percentage of cycle ridership in India, but at the same time, that is not supported by infrastructure at all. I can tell you that I've hardly seen any cycle lanes across India.
Thank you. And did you see any change during the COVID lockdown when there were less cars?
Okay, with regards to cars, there was a decrease during the complete lockdown that we had, but right now we're back to full traffic, complete mayhem on the streets, which scares me a little bit.
And are there any efforts by the government or by local administrations to kind of shift towards non-motorized transport?
On paper, yes. In Delhi, we see this sort of transit-oriented development being prioritized in the next master plan that is being done. So the master plan is supposed to be for 2021, but there are lots of, it's plagued by a lot of data discrepancies, and kind of doesn't have enough concrete actions that need to be taken. But on paper, there is supposed to be a transition towards transit-oriented development, at least in Delhi. I'm not. I think it's supposed to happen in Ahmedabad too, but again, there is a lack of proper implementation of plans.
Thanks.
Thank you. Any other questions?
Yeah, hi, Pritika.
Hi, Camille.
Hi, so yeah, I just wanted to thank you for this really informative talk that you've given. Yeah, so I'm from the Philippines,
Yeah.
and it was really interesting to see like a lot of parallels between like the experience of India with the pandemic, along with the experience that we have here in the Philippines. There's so much that's mirrored between us. I'm not sure about how much you hear about the Philippines over there. So yeah, I mean, it was just really good to see some sort of, suggestions as to how to improve things. I'm not necessarily in the urban planning sector, but, just because of this pandemic, I've been becoming more and more interested, at least in speculating on possibilities, about, there's always this question coming out during the pandemic of how to improve. And I do think that your talk, touched on a lot of the basic questions that I've been asking myself that I didn't know where to begin looking for answers to. So I really appreciate this whole evening. Thank you so much.
Thank you. Thank you. Thank you so much.